It's flu season again, and this time around it's a pretty severe case. Not only is the strain showing its face around here at Hempfield, but all around the country. Over the past 15 flu seasons, this current season is the first time all states in the entire continental United States have reported influenza-like activity.
Flu is a viral illness that causes a variety of symptoms including fever, body aches, cough, nausea, vomiting, diarrhea. It can also cause in younger kids seizures and other serious complications like death. Typically in a normal flu season, high-risk populations would include the elderly and pediatric patients under the age of 2. However, this year we've seen an atypical flu strain, and people with also respiratory illnesses like COPD and diabetes are also at higher risk.
Other high-risk populations include pregnant women, people with lung or heart disease, and anyone with a weakened immune system.
Right now for this season, we are seeing a dramatic increase in ILI or influenza-like illnesses, and we have not peaked yet. So that is the big concern. We've already surpassed the year that everyone remembers, which was the 2009 and 10 year when we had a new kind of flu virus. That was the H1N1 year.
Circulating flu strains this season are a mix of H3N2, H1N1, and B viruses.
So one of the biggest reasons the flu gets spread is that people don't use basic hygiene, particularly hand washing. So I can't tell you enough that hand washing helps prevent the spread of illness. Make sure that you get in touch with your doctor. So if you start with flu symptoms in the first 24 hours, there's a medicine called Tamiflu that's potentially going to help treat your symptoms and reduce the length of your illness. So the sooner you're in contact with a medical provider when you have the flu, make treatment options better. Make sure that you stay hydrated. Make sure that you take Tylenol and Motrin to keep your temperature down if it's not contraindicated with other medications that you're taking. And otherwise, stay out of public places where you might be able to give the illness to other people.
According to the CDC, more than 60,000 samples testing positive for influenza have been reported since monitoring for the virus began on October 1st.
I do encourage the flu vaccine, even a year like this where it's not effective, because you have to consider the flu vaccine is like investing in retirement or the stock market. When you make an investment, you're not exactly sure what's going to happen. You're making it based predicting what you think is going to happen. When laboratories make the flu vaccine, they are making that flu vaccine based on predictions of what strains are going to be circulating the most in the upcoming season. It's still very beneficial to get the flu vaccine because, again, like investing, if you get a flu shot every year that protects against 3 or 4 varieties of flu, those add up to be a bigger and bigger investment over time.
As the flu continues to spread, it is important to remember that it is strongly encouraged to get the flu vaccine. Hydrate and stay healthy. For Hempfield Happenings, I'm Caroline Ulrich.